Hello, I'm Todd Hall, President and CEO of TruLiant. As we mark our 70th anniversary in 2022, we reflect on a rich history that would not be possible without the support of the great city of Winston-Salem. From our humble beginnings in 1952 to the present, where we will soon serve over 300,000 members, hire our 1,000th employee, and exceed $4 billion in assets, to a future poised for continued growth, I am proud of the work we are doing together. TruLiant is grateful for and remains committed to Winston-Salem and all of Forsyth County.
Welcome to the Greater Conversations podcast. I'm Deetra Miller, the Director of Member Relations and Engagement at Greater Winston-Salem, Inc. We'll use this platform to showcase our local businesses, our community, and their stories. Hi, everyone. Welcome back to the show. It is my pleasure to introduce to you today Kathy Carr with SECU Family House in Winston-Salem. Kathy, thank you so much for being here today.
Thank you for the opportunity.
It is my pleasure. I'm so excited for people to learn more about SECU Family House and what you do and just the whole history behind it and the impact it's had not just in our community, but for people across the country that have traveled to Winston-Salem.
Sure.
So first, before we get into that, you are a native of Winston-Salem, is that right?
I am.
So let's talk a little bit about Kathy.
Okay.
Tell us about your background.
So I am a native to Winston-Salem. My parents came from Indiana when I was an infant and wound up staying in North Carolina and in Winston-Salem. My father is a retired general surgeon, and
Wow.
So I grew up here connected to the medical community because of my father. My mother was very active in volunteerism that was part of the health community, if you will. I graduated from Reynolds High School back when it was still just a 2-year high school. So
Wow.
I'm dating myself, but then went to Davidson College. Okay. And came back to Winston-Salem, worked as a travel agent for a few years until my husband and I married. I had met him at Davidson, and he went to medical school at Duke, and we got married, and then he did his residency in Gainesville, Florida. So we lived in Florida for the first 5 years of our marriage, his training. Had 2 of our 3 children there, and I worked for the Undergraduate School of Business at the University of Florida there.
Wow.
Then when we came, when it was time for David to find a practice, we both wanted to come back to North Carolina. He's from Eastern North Carolina, and I pushed for this side of I-40, and we were able to come back to Winston-Salem. So he started his practice in '92, and I was a stay-at-home mom. I had another child, and did all the PTA, church volunteer work, and was active in an alliance, which was an auxiliary of the Medical Society called the Medical Alliance of the Piedmont. That organization is defunct now, but had a storied history in Winston-Salem, helped start the crisis control ministry, pharmacy, the community care clinic, a lot of health-related initiatives. And in the year 2000, our founders, who were a local family here in Winston-Salem, experienced a personal hardship. Their 26-year-old son was diagnosed with melanoma, and his physician at then Forsyth Hospital referred him to Pittsburgh, to that medical community, possibly to participate in a clinical trial. And so they took their 26-year-old son to Pittsburgh and lived in a wing of that hospital cancer center and for about 4 months while he received his treatment. Came back to Winston-Salem. Sadly, Branner passed away at our local hospice, and within 3 years, the Baldwins, our founders, had started talking to people in the community and the hospital specifically to see whether we could build an adult hospital hospitality house. We have a Ronald McDonald House here in Winston. At that time,
that's where my wife works.
Oh, no kidding. Well, so you know everything about, because we're the same mission, right? We sort of consider ourselves a sister property to Ronald McDonald. And Winston has always had a culture of hospitality, if you will.
Yes.
And that Ronald McDonald House was built back in the 70s. But by their mission and under their Ronald McDonald House Charities charge, you can't stay there if the patient is an adult. So there seemed to be this need. We're blessed in Winston-Salem because we have 2 major medical centers.
Yes.
And those medical centers have continued to grow and expand their outreach and their affiliation, Wake Forest Baptist Medical Center's affiliation with the medical school and being an academic institution, it's quite a draw. And so our research, I joined as a community volunteer. My kids were aging out of school. I had time on my hands, and the project appealed to me because of my kind of unique connection to medicine. But my husband had patients who were choosing, making their medical decisions based on their inability to stay close to a cancer center for their treatment.
Okay.
And so it just made sense for us to explore whether Winston-Salem could support an adult hospitality house. And that's what the SECU Family House is. We're a 45-bedroom facility, and we opened in the fall of 2011. So we are now in our 11th year of serving our neighbors, really, people who live outside of Forsyth County. The patient is at least 18. There's a permanent residence for that family member to return to. Those are basically the eligibility requirements. The 2 hospitals make referrals to our facility, and then sort of we take it from there. So we're a hotel, but for a very unique niche population that maybe doesn't want to come to Winston-Salem, but is needing to for their specific medical needs that are stepped up from wherever they live. If they're in a rural community, there might not be those resources. Those are the kind of people that stay with us.
How wonderful it is that we have that here in Winston-Salem. I absolutely love that. And you mentioned that referrals come from both hospital systems.
Yes.
So what is it that a family would need in order to stay there? Do they just pack a bag and come? How does that work?
That's a good question. It's really pretty simple. Sometimes families are coming emergently. Perhaps a family is driving through North Carolina and they're in a car accident. They get airlifted to the trauma department at Atrium Health, Wake Forest Baptist, and they don't have anything with them. And so our community has brought in goods and things that they can use. But typically, they get over to the hospital in whatever door they're coming through, either the ED or the cancer center or scheduled procedures, and those departments of the hospital know about us, and they realize, hopefully, that the patient has some caregivers who are hanging around in the waiting room and don't have a place to stay. And so the referral kind of comes from those boots on the ground. Now that we've been open as long as we have, there's a lot of word of mouth. So somebody who lives in Boone goes to church with another family who winds up having to come to Winston-Salem for their medical care, and they say, well, make sure you get your request in so that you can stay at the family house. It's based on availability. Okay. As much as anything. We do have 45 bedrooms. When we first were studying the community and the hospitals were telling us that they did have this need, we did some research, and our data was telling us that about 400 families a day travel into Winston-Salem for their medical care. Now, some of those are coming from Yadkin County,
Okay.
Davidson County, just over the line. People work in those counties, right? And
Yes.
so they can go back and forth. So our sweet spot, if you will, has sort of turned into people who live about an hour and a half away.
Okay.
But in 2022, we served over 34 states out of our 50 states, plus Washington, D.C., and even some international guests. We had someone from Puerto Rico. We had somebody from New Zealand. We had a missionary who is from Uganda and wound up getting very sick and living with us for a while. Or his family members were living with us while he was in the hospital. And that's what we're at. We're about 60% of the people who we care for are the caregivers, and they have an admitted patient. But we do also have outpatients that are either receiving cancer treatments for an extended stay, and they might come in and stay with us through the week and then go home on the weekend and then come back. And they might do that for 6 weeks through their course of treatment. Winston-Salem, both hospitals have bone marrow and stem cell patients. There are also kidney transplants that are being done here. But 60% of our guests are the caregivers with somebody who is just really sick and is either in the hospital or in the ICU or getting treatment at the cancer center.
What is the average stay for
Right
most
now, it's about 4 nights.
Okay.
But we do, it sort of averages out to that. A lot of them are sometimes just 1-night stays. And those in our referral process don't get that priority because 1 night they typically could stay at one of our area hotels that provide a reduced rate. So if we don't have availability, we've worked with some of the great hotels in Winston that help accommodate those families at a reduced rate. Now it's not
That's
as low
great.
as what we ask for. We have a $40 nightly fee.
Okay.
All the rooms are subsidized, Deidre. The true cost of a room is more like $90, $91 a night. So all rooms are subsidized. We ask for a $40 a night fee for 1 room with 2 queen beds, so a maximum of 4 people. It's a hotel-like room with a tub bath shower, a private tub bath shower, of course. And then there's communal living. Our community brings in meals. So Monday through Thursday, we provide an evening meal for our guests.
Wow.
That's serviced by groups and or individuals that are volunteering with us. And there's always food in the house. We guarantee coffee. We have a milk money fund, that provides staples like bread and milk. I think what the most besides the affordable lodging and supportive care and just that food and shelter, what they are getting is a community.
Yes.
People who are in similar situations. They might even be from the same county and they don't know each other until they meet across the dining table at dinner. And they realize, I saw you in the waiting room over at the hospital, and they find out, they just live 15 minutes away from each other. So that's been kind of cool to see how we provide a community when they don't have their own community.
Yes, because going through that alone can be pretty awful. Going through it, period,
Yes.
whatever that may be for your loved one to be in the hospital, but to have community around you and other people to talk to and share, that must be so powerful for everyone that stays there.
Yeah, I think so, Deidre. And I think the other piece of that is the importance of caregivers taking care of themselves so that they can stay healthy enough to take care of their sick patient. And so they don't have to worry about what they're going to cook for dinner that night. They can just come back to the house and get provided a warm meal and warm it up if they come back later. We're staffed 365 days, 24/7. We have a security guard who is there during that third shift, but guests can come and go. So if they need to go to the hospital in the middle of the night, or if they wind up staying later at the hospital and they come in, they have access through our security area. But
that is wonderful.
so it's a very what I hear most often is just the gratitude that these families are sharing with us, even if their medical situation is dire and it's not turning out the way they had hoped. They at least feel cared for.
Yes.
And that reflects well on Winston-Salem, to be honest, because we're sort of the welcome mat for these people who are needing to travel to Winston. We also tout the fact that we support the two major employers in Winston-Salem with the two medical centers, and they work well together with this particular initiative because they realize the importance, regardless of which hospital campus they're staying at.
Wow, what an impact that Family House is having on Winston-Salem and other states, really, for folks that have to travel here.
Yeah.
And making that impact in such a way that it is caring and communal for those families and affordable as well.
Yes.
Whether they're staying in the house with you or, I can't believe, I'm just blown away that our local hotels, it's the sense of community that we have here in Winston-Salem, working with each other to help each other, is just great. So I'm not going to get all emotional about that, but I just love that. I really love that. You brought with you today a copy of the impact report. And if I remember correctly, you guys have served like tens of thousands of people. Talk a little bit about the impact that you've had over the past few years that you've been in existence.
Sure. Like I said, we started working on the initiative with a steering committee in 2003, became incorporated as a nonprofit in 2005. It took us a little while to raise the funds to buy the piece of property, which is just off of Burke Mill Road. We're neighbors with our Trellis Supportive Care property, which we just are down the cul-de-sac. So kind of off the beaten path, but 7 minutes from both hospitals, so that's convenient. The impact, when you look at it through these 11 years of operation, does talk about those numbers. In 2022 alone, we had almost 4,500 families that were supported, whether they were that's counting the guests, right? And then that's a collective $12,000 rooms a night, basically. Wow. So 12.5, really, I guess. But so if you kind of add all of that up, it really is a profound impact that still not a lot of people know about. And that's because if you live in Winston-Salem and we have these two major medical centers, you don't have to travel. You don't, unless you have some very special, rare disease that perhaps you need to go to Duke or MD Anderson and or something like that. We can really accommodate a wide range of illnesses and service lines. So it is pretty amazing. Our core values are hospitality, compassion, and support. It's pretty simple. It's just
yes.
Providing a little piece of humanity for people during a very difficult time in their lives. So because of that, it has grown. We have a lot of repeat visitors, if you will, guests, yes. because they might have follow-up treatments after their procedures. Because of our demographics, the patient is at least 18, and we've got a broad range of demographics of who can stay with us. Most of our people are the older population coming from the rural areas, and they might stay with us 1 year for the husband, and then 3 years later they're back with the wife being the patient or another family member. We have really seen that, so that's kind of fun. And we like to say, after they've left, they're family now. So if they need us, they need to let us know. And so that has worked. We do still get the requests or the referrals from the hospitals so that we know they're staying with us for the right reason.
Yes.
The market's coming up, the High Point market, and that puts a demand on the area hotels, and we always see our occupancy bump up during those peak times. April is always a busy time for us. River Run's going on right now, and so some people who travel and have been traveling for 10 years to Winston-Salem for their medical care are used to staying in a hotel, and a hotel might be a best choice for them, but sometimes or the hotel rate goes up, and so then they are all of a sudden finding out about us, and we've been around now long enough that our occupancy is at capacity for primarily. Year to date this year, we're at about 80% occupancy.
Wow.
And that's good. We had, of course, dropped during the pandemic when the hospitals stopped allowing visitors to come to the hospitals. That dried up our referral lines, but we've built back up, and we're pleased to be available to those people who need us. And if we can't get them in the first night, then we can often get them in the next night. So we keep that waiting list going. And so the impact, and if we can't get them in this time, if they're coming back the next week, we can sometimes get them in. So we try to accommodate as many people as we can. We're not an extended stay facility. We're not designed to be long-term stay. So we try to help families if they're going to be here for longer periods of time, look at some other resources in our community to help them with that. But we've sort of got a niche area that we're happy to be taking care of right now.
And you guys are making such an impact, but I'm imagining that you need volunteers to help you with that. You need the community coming together to bring you some of those things that you were talking about, the milk money, if you will.
Our wish list items.
Yes, talk a little bit about that.
Yeah, we have a great social media presence, and so when we're starting to run low on toilet paper or grab-and-go bars for breakfast, we'll put a shout out, and we get gifts through Amazon. People will drop them off if they're as they're checking out. They'll give us some gifts. So our guests are very generous about that. In fact, 36% of our total number of donors were former guests this past year. So they to us, that's showing the value of what we provide. But yes, we're always looking for volunteers. We were selected as the charity of choice for the Chamber's Under 40 Advisory Group this year, so we're so excited about that. It's nice to have young people who are interested in serving the elder population, because that's sort of who we're taking care of. Yes. And they're coming on the weekend of the 22nd to do some service work. So we're thrilled about that, and just trying to spread the word. That was a whole group of people in Winston-Salem who really didn't know much about us, and so that's helping us broaden our impact, if you will, because more and more community people know about us, and there are lots of ways to get connected. We have our annual fundraiser called Men Who Cook, which is a fun evening where we have invited amateur celebrity community members to be part of an evening where they're a chef, and they guest pay a ticket price, and then they go around and get appetizer bites, and that's fun. The Under 40 group has committed. I don't know who the people are yet, but they've committed to having a chef team.
Oh, that's fantastic.
So we're excited about that. That fundraiser has a peer-to-peer fundraising campaign affiliated with it. So the chef teams try to raise money for us too, and that's been fun. And again, it all just works collaboratively and helps us build our brand, if you will. And also, people need to know about us, and sometimes the hospital's too busy and they forget to tell that family member who's coming in from Henderson County that there's a place for them to stay. We do have a family assistance fund that helps offset. So even for those who $40 isn't a hardship, they can just report out some information and receive a reduced rate. But everybody does pay something. And they want to pay something. You know, they want to give back in the way that they're able to. So it's been a joy for me to be a part of, and I can't see myself, doing anything else at this chapter in my life. So pleased to be here.
We are absolutely thrilled that you're here. We're thrilled with the work that you're doing. And you mentioned Men Who Cook. I know that our president, Mark Owens, has participated in that.
He did. He was great.
Walter Farabee, who was with us for a while, and
the
he's
two
now
of
with
them
Reynolds.
were our team, right?
And I think recently, maybe our CFO, Nick Reed, participated, possibly?
I don't know about that, but
well,
we need to connect with him.
Yes.
He likes to cook. Yeah, that's good. It's always good to know. Michael Hastings this year is coming back. He had helped us with several of our events and had to take a year off last year for timing, but is back. So will be our judge, and has recruited some other community members that are going to be the judges the night of the event, and we're excited about that too. So it's a fun event.
Pardon me while I clear my throat. You know that I am the man who ate the town. The food journalist. So.
Well, I am so thankful that you've shared that with me. I will get right on that. I did not know that.
Yeah, so now you know. Yeah. I am the man who ate the town.
He is the man who ate the town, so he will be happy to participate.
And Michael and I judge a lot of things together. So.
Okay, well then we might have room for you too. So that'd be good. It's fantastic. Fun. It really is a fun.
I love judging food things.
That's good to know. That's good to know.
So for everyone listening that wants to know more about SECU House, Family House, more about how they could possibly volunteer or donate or even get involved in Men Who Cook.
Yeah, we'd love that.
How do they find out about that?
The easiest way is just to go directly to our website, which is www.familyhousews.org. 768 I don't call it enough. 793-2822, area code 336. That's our main office number.
Perfect. And I'm guessing you're on all the socials as well?
We are. We have a Facebook page. We have an Instagram. We have our Twitter doesn't get a lot of work on it, so that's okay. Facebook is really a good fit for us because so many of our former guests stay connected to us through Facebook. And so that's kind of our jam right now.
That's your jam.
Yeah.
I love it.
Yeah.
I love it.
Yeah.
Kathy, thank you so much for taking the time to be here today
and to
share more about what you do.
As you know,
it's amazing.
I talk about it forever. So thank you. I appreciate being here.
You're very welcome. And for everyone listening, until next time. We know you enjoyed this podcast today, so join us for the next episode of Greater Conversations. By the way, you can follow us on social media. We're on Facebook, Instagram, Twitter, and LinkedIn. Be sure to smash that subscribe button. Also, be sure to visit our website at Winston-Salem.com. The views and opinions stated in this podcast are solely those of the contributors and not necessarily those of our sponsors, distributors, or hosting companies. This podcast is copyrighted and cannot be reproduced without expressed written consent of Greater Winston-Salem, Inc. or your toast.